Hi guys, Aarvi here from ProPhysio Plus. Today we're going to be talking about patellofemoral pain and its causes, and it actually can go away on its own. So please like this video, subscribe to our channel and share with your friends. So let's jump in. So does patellofemoral pain go away on its own? Well, this depends on each person and the intensity of the pain. So sometimes it can disappear on its own without you getting any kind of treatment. But I would not risk that if it has been persisting for a couple of months, and leaving it can take longer for it to recover, and it can cause more damage, especially if the weaknesses are not addressed. However, the literature does state early appropriate rehabilitation may be critical to preventing poor outcomes and optimizing function for individuals with patellofemoral pain. So a common problem is, how long does it normally take for patellofemoral syndrome to actually heal? Well, once again, this will depend on the person and the intensity, but you'll be looking at anywhere from 4 to 6 weeks of rehabilitation, and even longer in some cases. This will include reducing the load early while building the strength on the areas that are weakened, and then gradually return to load and progressively building up load, so there's increased tolerance and reduced chance of re-aggravation, which is quite common with this kind of injury. So coming back too soon can lead to a recurrence of the injury, therefore a gradual return is best suited to get the maximum results. All right, hey guys, so this is a common test, or a couple of common tests that I do in the clinic, especially with someone that's coming in with suspected patellofemoral pain. So it's pretty simple, you can do it at home. It's pretty easy to find out what's sort of going on. So I normally start off with just a simple single leg balance. So I'll get Leki here today to just stand on one leg. Good, hold that for a couple of seconds, and then we'll switch sides. Yep. And do that a couple of times. So every couple of seconds, just switching over. So what am I looking for? I'm seeing what's happening with the knee, and if the knee's actually caving in, or if it's maintaining a quite stable balance, or if it's going outwards. So the main thing what we look for, if the knee's bouncing back in, there's usually indication of something patellofemoral going on. So if he's pretty good at that, or I suspect something, I'll challenge him a little bit more to see if it gives me a bigger picture. Pretty simple, a single leg sit to stand. So all I'm going to get Leki to do is, we'll move the bed a little bit lower because it might challenge you. Good. So you want to go about parallel depending on the person. So all I'm going to get Leki to do is just stand on one leg. We're going to look for the same things that we look for the single leg balance, how the knee operates. So we're going to go slowly down, touch, and then coming back up. Do that a couple more times. So as you can see, Leki's knee's pretty stable, it's not coming in too much. And then we'll compare to the other side. Good, and we're also looking at how he's controlling his lowering and how he's actually coming up. Most of the time there'll be a weakness on one side, and with patellofemoral there'll be a knee caving in a lot more, and that usually indicates that's the side that's positive. So there's some common tests that we do in the clinic, and they're pretty easy to do. Cheers.
Hey guys, today we're going to be going through some quick fire questions that we commonly get in the clinic, and it's also commonly searched for in Google. Enjoy. Question number 1, Aarvi, what is patellofemoral pain syndrome?
Good question. So it's used as an umbrella term for pain arising from the patellofemoral joint itself, so anything around that knee area, and to the adjacent soft tissues. So it's a chronic condition that tends to worsen with activities such as squatting, sitting, climbing stairs, and running.
Thank you. Question number 2. Common causes of patellofemoral joint pain.
All right, so there's a lot of causes due to this umbrella term, but common ones are problems with the alignment of the kneecap, as you've seen in the testing that we did earlier, overuse from vigorous activity, training load and surfaces are significant factors. And this is a common one, a young female population, due to their structural changes due to the Q angle. So what's that? It's defined as an angle formed between the quadriceps muscle, so in front of the leg muscle, and the kneecap, so the patellar tendon. So as females have a larger Q angle, you would normally see, especially younger females, their knees cave in and it goes in that way. That's a big cause for this kind of pain, and which leads to patellar maltracking and dynamic knee overload.
Q angle, so watch out for that one, ladies. Question number 3, so does patellofemoral pain go away?
Well, this one depends on the person and the intensity of the pain. Sometimes it can disappear on its own without getting any kind of treatment, but I would not risk that at all if it's been persisting for a couple of months, because the longer you leave it, the longer it takes to recover, and it can cause more damage, especially if the weaknesses are not addressed, and it'll eventually lead to some osteoarthritis in the knee as well.
Question number 4, how long does it help to heal and rehabilitate from patellofemoral pain syndrome?
Once again, this will depend person to person. However, you'll be looking at from anywhere from 4 to 6 weeks of rehabilitation. So that's not when you get the injury, it's when you actually start the rehab, and it will be even more in some cases.
Okay, question number 5, last one. What exercises are great for patellofemoral pain?
It is best to do a thorough assessment on the person and find where the biggest weakness lies and address that first and build from there. Commonly in the clinic, it'll be a weakness around the hip girdle, and the glutes are the main muscles that are under firing. So in the blog post, I have a list of exercises that I found in literature that also work. So check out our blog post, and then you can have a bit more read on that.
Awesome, guys. There you go. Heaps of resources for you to get on top of your knee pain. And if you've got any questions, don't hesitate to reach out. Making healthy simple.
There you have it. We've laid out what patellofemoral pain is and if it magically disappears. So please let us know how you went with it, and please like this video, subscribe to our channel and share with your friends. And remember, making healthy simple.